My name is Sheila and I live in the Wire. For 20 years I worked at the wonderful Trinity Hospice that we have here in Bispham. Following on from that, and my current post, I'm working for NHS Pensions. I was admitted into the hospital. I'd been poorly for around 14 months, but didn't really understand why I wasn't feeling very well. I was struggling with a lot of pain. I do have fibromyalgia, and I was putting it down constantly to being that problem just getting worse. One day the pain that I experienced was so severe that I more or less passed out with it. It ended up that I had severe pancreatitis and was admitted to the hospital by my doctor. I then had a second attack of pancreatitis. This time was admitted via the accident and emergency. And finally, I was admitted again to have the gallbladder taken out. At all times when this was occurring, the treatment that I received was absolutely exemplary. They are giving absolutely everything of themselves, way above expectation, and we need to acknowledge that. On the television, you often see that they try and shock you, and they give you the views of the corridor, and everybody's waiting as if you're on a train, and they give the impression that in those corridors there's no way that you could have the treatment that you require, and that this is absolutely a most horrific situation for everybody. Yes, it is, because it's the shock of seeing the reality of it. But the treatment that you receive from the staff who are under the most appalling stress, as they come down to check and they are not allowing you to see that stress because they're smiling at you, they're speaking to you in gentle tones, they're assisting you as much as they possibly can, they're apologising for the delay that you're having. This is way above what you would expect from them working on their day-to-day. Even when the doctor finally got to me, her first words were, with a lovely smile, "I'm so sorry for your delay, and a bed has now been found for you." Right the way through, they kept popping in to make sure I was all right. You have a difference in wards. You have Ward C, which comes across as a very old ward. And with that, I was moved into that quite late at night. And there were many, many patients because it's a very long corridor. And I was admitted, and I was admitted into a ward with quite a few people. Immediately they came to see to me. Immediately they started to put me at my ease. I saw wonderful treatment of patients going on around me who were in a far worse state than I was, and yet they cared for them. They took abusive words and dealt with them, still in kindness. Because sometimes when patients are in a lot of pain, they're maybe not the personality they would normally be. And the nurses seem to accept that, not accept somebody being very rude when there wasn't a need to it, but understanding the difference between a patient who's been really poorly, maybe saying something. And I noticed that. On Ward 15B, which was superb, absolutely superb, one night there was a nurse on, and on that ward at night she also had to deal with somebody that appeared to have Alzheimer's. The patient was wandering up and down, there was not many staff on, and she was dealing with calls, etc. at the same time. And having had a father who died from Alzheimer's, I wasn't deliberately listening, but it's surprising how your brain takes things in. And as she was dealing with this man who was constantly walking up and down, opening doors he shouldn't have, she was kind, patient. She was trying to take away his disassociation with the place. She constantly told him where he was, held him gently. I could see him passing. And again, that astounded me, that in the work she was trying to carry out for everybody else, she would find time for this very difficult situation within her ward. I would like to say a very personal thank you to the young nurses who have just come in, from the senior staff that have been there a while, from one lady in particular, who I can only describe rather than give a name to, in Ward 15B, who tends to work evenings, who's a lady who will come and give you a hug, which I absolutely loved. She gave so much of herself with her hug. Hugs you as she sees you, hugs you for any reason. Another member of my family has recently been admitted to 15B and had lovely, lovely treatment there. Thank you. Carry on what you're doing. You're brilliant. And, you know, I'll fight to try and get you more wages, like everybody else if we can. But thank you.
Hi Sheila, can I thank you very, very much for all the comments, wonderful comments that you've said. It's been a pleasure and an honour looking after people in the NHS, and often we get very busy and we don't feel that we're doing our job as we should do. For somebody like yourself to have taken the time and the trouble to respond and put forward of how well we're doing, I cannot thank you enough. It has been a pleasure and an honour to feel that I've made in any small way a contribution into your well-being. This is a wonderful, the NHS is a wonderful place and everybody works very hard as a team. But to have somebody who recognises all the struggles that we go through and that we try to give the best care that we can, I find it very humbling that you've acknowledged that we've made some small difference. Thank you.
Thank you, Sheila, for those lovely comments. It's lovely to hear that the staff have done such a wonderful job. They'll be very proud of this, and I will share it with them and tell them of all the good news and all the good things that you've said. Thank you very much.